Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello again. And this podcast episode is actually marking a little bit of an anniversary. Is the anniversary of 1 year from, actually it's a year and a month from when I launched my podcast. Now, I did launch the podcast in the first week of August 2023. And even though it's definitely reaching a lot of my own personal patients, I know it also has been reaching other people and touching other lives. And as I revealed in my first trailer episode, the reason for the podcast was somewhat selfish because I felt like I was teaching and preaching and saying the same thing over and over again to different patients. And I really felt my patients needed an educational tool to know more about their bodies and their health, empowering my patients to make better decisions regarding treatments, allowing them more time with me to ask me specific questions, which obviously would give my patients the power to make better decisions for themselves. And then obviously that can also be applied to many other people. And I've had patients who start listening to the podcast and then they come into my universe as patients because they've heard of the podcast from someone else. Now, this week I decided to get off script and kind of do a little something related to our healthcare system. Because as I passed episode 55, I want to stop a little bit with all the education and maybe have a few episodes with some philosophical musings on what is really happening to our healthcare landscape and what could possibly be happening in the future. So first of all, I want to talk about the healthcare aspect. I want to talk about what does being healthy mean? What does being sick mean? And what do we need to look forward to if we want to stay healthy? And I want to talk a little bit about the sickness epidemic that's spreading like wildfire and is obesity, cancer, chronic illness, chronic fatigue, and mental illness, and discuss a little bit of what could be the core issue of why this is happening. And this is a very hot topic in today's political climate. As you can see, some of the candidates for political presidency in the United States are actually debating and talking about health issues because health is such a big problem for our American citizens right now. Now, if you have listened to some of the podcast episodes, I think at the beginning of 2024, I did a series on the healthcare system. And again, it started out as an educational topic to inform people in general, but my patients in particular, about how the healthcare system works, at least from our point of view, the physicians. I pointed out some of the very important things for you, the patient, the listener, to know. And the truth is that our medical system today is very much changed compared to what it looked like before the ACA law went into effect. That's, if you don't know what the ACA is the Affordable Care Act or Obamacare. The most obvious consequence, unfortunately, what this did is this new ACA law has unfortunately made medical insurance become unaffordable for many, many people. I hear that every day from at least 1 or 2 patients a day that complain that they pay thousands of dollars a month on premiums, health premiums, and they're not being covered for anything other than a small percentage of a possible hospital admission, major surgery, or catastrophic illness that every single visit they have, all blood testing they have to pay out of pocket. Now, the problem is that most people pay the equivalent of a monthly mortgage every month for an insurance plan. So it's at least $1,000, $2,000 per person. And unfortunately, this type of plan will provide some help in case you need a catastrophic procedure done, like bone breaks, you need surgery, you, God forbid, have cancer therapy. But in reality, you get minimum help from this plan for regular doctor visits, for blood or imaging testing or minor procedures. And I say minimum coverage because as a patient, you will need to meet your deductible in most circumstances before you actually get any coverage. And that deductible amount could be anywhere from $2,000 to $7,000. Now, what is mind-blowing to me, the doctor, is that people are still coming to the office. We discuss costs because people want to know, how much is this going to cost? Am my insurance going to pay for it or not? So as soon as they ask how much this is going to cost, I answer with, do you know what your deductible is? And believe me, 90% of the time, people still say, no, I don't know. What's a deductible? So please, if you're listening to this podcast and you're an American, and if you have health insurance, not government funded or covered California or covered some kind of ACA plan, sponsored, funded by the government, but if you have private insurance, you need to know your deductible. It is the most important number you need to remember as far as your healthcare cost. Now, here's the thing. You drive a car, so I bet you know the deductible for your car insurance if you get into an accident, which is how much money you have to pay before your car insurance company will pay to repair your car. Well, what about your homeowner's insurance? You should know how much your homeowner's insurance deductible is because if your house catches fire and you have to rebuild your house from scratch, you will need to know how much you have to pay before your house gets built back up by the insurance company with the insurance company's money. So please ask yourself, if you do not know what the deductible is, why you don't know that number. Please find out what that is and remember it. And also know that if you change your plan, your deductible will change. So please know what it is at all times. Some plans have it spelled it out on the insurance card, really easy to see. But most plans you really have to call, you really have to remember or write it down somewhere. Now, because the monthly premium for health insurance is so high, many people, not all of them, but many people bulk at spending what they see extra dollars on top of their monthly premium. These extra dollars come straight out of the pocket. Many people get angry and frustrated with the cost of healthcare. Now, many people, unfortunately, get angry and frustrated with the medical staff because, well, we're right there in front of you. We're front line. However, please understand that the cost of healthcare you receive through your insurance is determined by the insurance plan, not by the doctor. The doctor, for example, can charge $1,000 for a comprehensive new patient visit, but your insurance plan that the doctor has contracted with will only pay maximum $220 for the 1-hour visit. Your doctor pretty much agreed to this price in order to be part of the network. So again, this comes with its own mathematical consequences. Think about this for a second. Let's do some simple math. If this is maximum what a doctor gets for about a 1-hour consultation, if you have 8 patients that are all new patients or they have comprehensive consultations that get paid $225 an hour for 8 a day, because that's how much a doctor works, 8 hours a day, that's about $1,800, which is maximum about $468,000 a year if you work with no vacation Monday to Friday. Now, if the practice would bring in revenue for one provider for $468,000, how is that practice going to pay for all the medical assistants, front office receptionists? How is the overhead going to get paid? This is impossible. So many private doctors are practicing independently because they offer cash services that are not covered by insurance. And after a while, many doctors get the taste of cash or taking out the middleman, taking out the insurance, taking out the biller, and they love it. And then they decide, I'm done, and they stop accepting insurance. So let me talk a little bit about what if you would pay cash for medical care. Just let me paint a different kind of picture for a minute, because that's important and it might help you, the listener, decide if this is the right fit for you. I'm not saying it is, but just hear me out. Now, let's say your doctor was calling the shots on the pricing and they will only charge you about $600 for your first visit and about $200 for follow-up visits. This is about pretty much average for the area I practice in. And then you ended up seeing the doctor about, let's say, 12 times a year maximum, right? I mean, how many people go to the doctor once a month? Not that many. No one sees the doctor that often, but let's be the devil's advocate and say you go 12 times a year. That's about $3,000, $3,500 a year spending on doctor visits. Well, maybe you don't need to see one doctor, but maybe you need to see a few doctors, each one of them about 4 to 5 times a year. So it still comes out to about the same. Because if you pay cash out of pocket, you might see the primary care doctor, the gynecologist, the ophthalmologist, the cardiologist, the gastroenterologist, so on and so forth, right? Now, if each one of these doctors were to cost you about $1,000 a year or maybe more, it would cost you somewhere between $5,000 to $6,000, maybe $10,000 max a year out of pocket. That's no insurance. It's just between you and the doctor. Let's say you need some blood testing. You're like, how much is that going to cost? Well, somewhere of a comprehensive initial blood test analysis will be anywhere from $400, let's say maximum $800. Some follow-up testing to monitor you throughout the year, your hormones, your thyroid, your sugar, your cholesterol, maybe another $200 to $300 4 times a year. That's about a grand total of $2,000. So you need to get fancy. You need to do some functional medicine, food allergy testing, GI map, microbiome testing, SIBO testing. Consider another $300 per test. That's another $1,200 a year. Again, it's all this blood testing can come up to about $3,000 a year or maybe more. What about the cost of cash imaging? Pelvic ultrasound, mammogram, breast ultrasound, bone density. Each one actually costs about $250 each. So if you need all of those in 1 year, that's about $1,000, maybe $2,000 max. And let's say you need a CT, an MRI, those run about $400 to $450 each. Now, how do I know these numbers off the top of my head? Because I deal with them every day. People ask, how much this is cash? How much this is cash? So I have a little price menu in my brain that just kind of like automatically, after 10 years of practice, I know exactly what it is. And prices might change with time, and they've gone up a little bit because the MRI used to be $300 and it's now $450. Again, Bidenomics. So you add about $3,000 for doctors, $3,000 for labs, $3,000 for imaging. I mean, you're looking at about $10,000 if you're going to spend cash. Now, all of this is upfront, no middleman, no insurance billing, no fees. And that's about $1,000 to $1,500 a month. And there's no insurance involved. Now, that's not necessarily a good thing. For this model will not cover you at all if you have catastrophic needs, an accident, a bone breaking, a surgery, hernia, all kinds of things, right? So cancer, God forbid. So, however, there are plans with a $10,000 deductible where you will have to pay the $10,000, which you might not need to pay $10,000 every year. You just pay a little this year, fix one thing, you pay a little next year, fix the other thing. However, once the insurance is involved, you no longer will be quoted the cash price, because what costs $300 for a blood test could actually be billed to your insurance at $2,000. What costs you cash for an MRI at $450 can be billed to the insurance at over $2,000. The insurance has a negotiated price with all the major labs, the imaging centers. If you have a high deductible that you haven't met, you might need to pay more than the cash price if you go through your insurance company. So that's why high deductible people decide to pay cash only, and they just hope that they're never going to get to meet their deductible. They're never going to need to do that catastrophic coverage requirement where you, God forbid, had need surgery or other things. So most people never need all of this care that I mentioned. It's unlikely that you're going to need everything that I just mentioned as far as medical visits, testing, imaging, all of that. Now, the problem is most people are very healthy, or they try to stay very healthy, or at least the people that come see me, they're trying to stay very healthy. And most of them need hormone replacement, hormone therapy. They need some blood testing for that. They need an annual. They need an ultrasound. So many of them, many of you, perhaps listeners, might think about, well, my health insurance premiums, and I've seen this mentality in some of my patients, my health insurance premiums are an investment in my health. Well, in reality, you're not investing in your health. And this is why I went a little bit around to this point I was trying to make. So hopefully you stuck with me and you made it so far. What you are doing, you're not really investing in your health by paying your monthly premium. You are unfortunately making some very corporate private insurance stooges very rich. And of course, the richer they get, the more people they hire to come up with ideas on how to siphon all the money away from you, the consumer, and from the healthcare provider who's providing the care into their pockets. However, like I said, the hospital care is very expensive. You need some form of insurance if you're over 50, because in case you suffer an accident, surgery, cancer, God forbid, then you need to have something, some kind of coverage. Now, if hospital care was more affordable, many people would likely save their money and stop paying for health insurance. So private insurance companies might reconsider their high premiums. But right now, they're in demand because everybody's afraid after 50, so they all buy health insurance. Now, I honestly think that this private health insurance cost is so high and the monthly premiums have become so expensive, from what I hear from my clients, that this situation is really untenable. We have inflation. People are not being paid as much as the premiums have gone up. So many will really welcome universal government-funded and guaranteed healthcare, which is unfortunately a landscape where only the very rich will be able to afford to pay insane private insurance premiums. Everyone else will go to clinics that will be funded by the government. And that's very likely a landscape where the regular people who will pay for affordable premiums for a government-funded plan, universal healthcare, might need to wait in line to be seen. And that's very similar to what's happening in Canada, in New Zealand, our friends up north, our friends down to the south, down under, Australia, New Zealand. So some healthcare systems have got it all figured out. So you do wait 6 months for a hip replacement. And if you can't, then you're going to have to pay out of pocket to get it sooner and see a private paid doctor. Now, at this point, the private insurance company might want to contract with some, let's call them elite doctors, which are technically private doctors at this point. Otherwise, why would their clients go to the same clinics everyone goes to? Then they would just buy the government-funded healthcare. So maybe in this specific landscape, doctors could name their price, worry less about not being paid, about insurance asking for their money back, claiming they overpaid you, worry much less about not providing care or services and then not getting paid at all at the end, or getting paid months after they provided the service. They might not worry that a good chunk of it goes to a billing service because there will be enough money to pay the biller. So there might be a better landscape for private doctors, and it might be a better landscape for people who might get more open to, I'm paying less and I'm willing to wait in line and see someone at a clinic rather than just go and have a concierge practice access type of care. Now, let me move away from this subject of healthcare cost to how to choose the best treatment. And I want to make a very important point, so please stick with me because I'm getting somewhere. Now, interestingly enough, in the United States, and hopefully everywhere around the world, or at least in countries with advanced medical care systems and advanced technology, we, the doctors, are supposed to live, breathe, and practice by the principle of autonomy, at least where healthcare is concerned, and us providing healthcare to patients. However, this principle of autonomy, which means you inform the patient and you let the patient decide, goes out the window when the patient has no idea what to choose from all the treatments that are available. Also, it's very hard for them to be able to autonomously make a decision when they're not informed of all the possible options. And I discussed this in other episodes, how the doctor doesn't have time to spend an hour at every session going over all the possible options, pros and cons for a very specific condition like endometriosis or adenomyosis or fibroids, because they're limited. So they're going to look at the big picture. They're going to look at your age. They're going to look at your symptoms. They're going to say, okay, let's manage this with birth control pills. Here's a birth control pill prescription. Let's manage this with an IUD. This is what the IUD does. I think it would be a great fit for you. If you have any questions, let me know. If not, let's book it. So unfortunately, as a patient, when you do not understand the situation from a medical standpoint, or you cannot grasp the total ramifications and consequences, whether they're medical or financial, and whether or not the insurance will cover a procedure or a treatment, it complicates the issue. It makes it even more difficult to choose when you, on top of the medical stuff, add finances, right? So talking about cost and insurance coverage a little earlier, and when patients get confronted with the topic, which is insurance coverage options, it confuses the picture for a lot of people. Some people get upset because we don't reveal enough information about cost, us, the healthcare provider. And that's not because we don't want to, but honestly, it's because we do not have that information. We do not know for each specific plan what is the allowed amount to a certain procedure. You really will have to call the insurance plan. We can give you the code for the procedure and then find out how much is your insurance going to pay for that plan and whether or not it's going to get covered. We don't always know. Now, on the other hand, some people get upset because they feel cost shouldn't be an issue and is best left for after the procedure. However, there always should be a cost discussion between the doctor and the patient. Many times, the truth is that the cost can be a lot more than expected after billing is done. Rarely, it could be a lot less. And unfortunately, many doctors avoid having this conversation because we doctors are not business people. We're not in sales. We're not selling you a procedure. We're very blunt about, look, this is what you need. Because in our mind, the doctor, you need to know the facts, understand the condition, review your options, make a decision. Now, sometimes the decision is very clear. And to us, it's like, okay, well, this is the case. This is what you have. This is the best treatment for you. And this is easy. Sometimes it's very complicated because it depends on the circumstances. And ultimately, unless it's a patient that's unfortunately diagnosed with cancer, in which case treatment, even then, there's some contentious issues with chemo, no chemo, radiation, or radiation. However, usually there's lots of options available. Even to surgical management, there's options available, right? Now, many patients avoid the cost conversation because they believe the insurance plan would and should cover their care or their procedure. But this is not your belief. The cost and the coverage is not based on your belief. And this is a problem with a lot of people. Now, I stressed out the word should or would because it's exactly how many people feel. And it has nothing to do with reality. So the reality is we have no idea if your insurance is going to cover. Sometimes we call the insurance company, we get what's called verification of benefits. We get a person on the phone, very nice, very pleasant. They tell us, yeah, with this CPT code, this ICD-10 code, sure, it's covered, no authorization needed. And then you bill, and then you find out, well, no, it has to be applied to deductible. So we don't know beforehand what will be applied to deductible, what would not be applied to deductible. And the reality for you, the client, is that you're paying a very steep monthly premium to become a member in a plan. This plan has very strict rules. This plan will only pay for certain things at a certain rate and only if you see certain doctors. So unfortunately, a conversation about cost should always happen. The more information we, the doctor, can provide for you, the patient, the better. And the more information the patient asks for, the better for them. Now, unfortunately, many doctors find themselves in the end holding the bag, so to speak. Sometimes it's an empty bag. After they do a procedure for a patient, they bill insurance. Turns out that procedure, the delivery was thousands of dollars. The patient is responsible. And the patient now doesn't want to pay, or they say, well, I need a payment plan and I need 12 months to pay it. So, of course, doctors can send patients to collections, can stop seeing them. None of us wants to find themselves in that situation. Neither us, the doctors, nor you, the patient. So, unfortunately, doctors are starting to insulate themselves from this type of circumstance or situation with some kind of a fee. And we're also implementing fees in my practice. If I go to do a procedure at the hospital, we are starting to collect a deposit at this point. Your insurance pays for the procedure. Great. Here's your deposit back. So again, or other doctors have concierge models, monthly fee, annual fee, where the doctor takes your insurance, but then you have to pay the fee if you're part of the practice. So to come back to what I was saying about the best treatment, and this was a little bit of a side comment about cost. As a patient, you should always know what a treatment costs. Unfortunately, due to current economic conditions, the rate of inflation, many people, you included, would probably like to make a decision for a treatment taking into account the cost for that treatment. Now, here's the thing, and this is where I was getting at. The problem is that when cost is an issue, you are no longer choosing the best treatment for you. Now you're choosing the treatment that you can afford. And that is a big difference. So how do you avoid needing to be forced in choosing the treatment that's cheaper? How do you choose the best treatment? I have a very simple answer to this specific pickle of a situation. And it's very, very simple, but you might not like it because it's staring you in the face. The best solution, the optimal ideal situation, is not to need any treatment because you are healthy. Now, does that mean you don't need to invest in your health? Does that mean that being healthy is cheap? No. Ultimately, in the end, it's still going to cost you some money. And I'm going to keep talking about this. What does healthy mean? How much does it cost? Is it cheap? No, none of this. Being healthy might involve quite a lot of expenses. And by that, I mean the expense of money, but also the expense of time. You have to go fresh, clean, organic food. You have to shop for food. You have to prep your food. It might mean expensive monthly payments at the gym or at the yoga studio for classes. It might mean the cost of acupuncture or regular massages. And on top of all this cost, it involves the expense of time. You need time to exercise. You need time to shop and prep your food, unless you're rich enough to hire a private chef that cooks for you every day. You need time to go to the gym. You need time to walk the dog if you have one. And remember, walking the dog is great exercise for your mental health, maybe your cardiovascular health. It will not help you keep muscle mass where you need it. Walking the dog will not help you lose weight or keep the weight off. This is something I hear a lot. Well, I'm walking the dog every day. Great, but it's not going to help your weight. And on top of all the shopping and the prepping and the exercising and the acupuncture and the meditation and the yoga, last but not least, to stay healthy, you will need a captain at the helm of your ship, a primary care doctor that will be with you, confirming that what you're doing is paying off and you are in great health. I love talking about this subject, investing in your health. Let me point this out. You do not invest in your health when you're sick and when you need to pay a lot of money on doctor visits, on blood testing, on imaging, on medications, on vitamins, supplements, and procedures, because this is similar to having an accident and paying for a car repair. Now, let's talk about your car for a second. You take your car in every few months for the oil change, for the cabin filter change. You rotate and align your tires when needed. Why would you believe that your body is not worth a preventive wellness visit at least 2 to 3 times a year? Obviously, with a wellness-focused and wellness-oriented doctor. And if you want to know more about this topic, I had a whole episode entitled, Do We Need a Wellness Expert? So please visit that episode. For now, I would like to leave you to ponder what you do for your car and how you take care of your car and what you do for yourself. Consider whether you are treating your body with the same care and respect that you treat your car. Now, if you live in California or some other places in the United States, you know you can't do much without a car. You can't go to work. You can't go shopping. You can't go and have fun. You can't eat out. You cannot hang out with your friends. You cannot go to concerts. You cannot travel to the airport to pick up a flight. You need your car. We spend many hours a day in our car in California. Look at what you do for your car. You put gas in it. You wash it. You clean it. You change the oil. Consider what your body needs. Treat your body with the respect and the courtesy that you treat your car. Now, in my next episode, I'd like to talk about why we are so sick in America today, maybe worldwide. And I would also like to talk a little bit more about what does it mean to be healthy? Like, what is the definition? I am honestly looking forward to next week. And for now, I'll leave you here. Again, pondering on how much money, time, and dedication do you actually spend for your own body, which in the end is the most important possession that you will ever have in your lifetime. My business card says, your body is a temple. Please worship daily, for a reason, because I believe a healthy mind needs a healthy body and vice versa. Now, I do not know if you're familiar with mens sana in corpore sano, which is a phrase that has come to have a very wide range of meanings, but overall it means only a healthy mind can lead to a healthy body, and equally that only a healthy body can produce or sustain a healthy mind. Again, next episode, I will talk about mental health, emotional health, physical health, as well as the loss of health caused by disease. So please join me next week. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you, if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.